One of the most common questions people ask after being diagnosed with macular degeneration is, how quickly will it affect their vision? In this lesson, we'll talk about how macular degeneration progresses and why the timeline can be different for each person. Welcome to Macular School. I'm Corey, a certified low vision therapist. In this series, we explain macular degeneration and share practical strategies that help people stay independent as vision changes. Today, we're looking at how macular degeneration progresses over time. One of the first questions people ask after being diagnosed with macular degeneration is this: how fast will my vision change? When someone learns they have a condition that affects the retina, it is natural to wonder what the future may look like. Many people want a clear timeline, but macular degeneration does not follow a single predictable path. For some individuals, changes occur very slowly over many years. For others, vision may change more noticeably over shorter periods of time. Understanding how macular degeneration progresses can help people feel more prepared and more informed about their eye health. The most common form of the condition is dry macular degeneration. Dry AMD usually develops gradually. Doctors often describe dry macular degeneration using stages. These stages include early, intermediate, and advanced macular degeneration. In the early stage, small deposits called drusen may appear beneath the retina. Many people at this stage have few noticeable symptoms. Vision may still feel relatively normal. As the condition progresses to intermediate stages, individuals may begin noticing difficulty with fine detail vision, such as reading small print. Some people also notice mild blur in the center of vision. Advanced dry macular degeneration occurs when retinal cells in the macula become more significantly damaged. Because this process typically occurs slowly, many people adapt gradually over time. A smaller percentage of patients develop wet macular degeneration. Wet AMD occurs when abnormal blood vessels grow beneath the retina. These vessels can leak fluid or blood into the macula. This leakage can damage retinal tissue and may cause more rapid changes in vision. For this reason, wet macular degeneration is often considered the more aggressive form of the disease. However, modern treatments are available that can help slow or stabilize the condition. When wet macular degeneration is detected early and treated appropriately, many individuals are able to maintain useful vision for extended periods of time. Early detection plays an extremely important role in protecting vision. Another important reason progression varies is that each individual is different. Several factors can influence how macular degeneration develops over time. These factors may include age, genetics, cardiovascular health, and lifestyle habits. For example, smoking has been strongly associated with increased risk of macular degeneration progression. Overall health also plays a role in the health of the retina and blood vessels. Because these factors vary from person to person, two individuals with macular degeneration may experience very different timelines. This is why doctors focus on monitoring the condition carefully over time rather than predicting a fixed schedule of changes. Monitoring vision regularly is one of the most important parts of managing macular degeneration. One simple tool often recommended by doctors is the Amsler grid. The Amsler grid is a pattern of straight lines used to detect visual distortion in the center of vision. If the lines appear wavy, bent, blurred, or missing, this may indicate a change in the macula. Some patients check their vision using the grid regularly at home. If changes are noticed, contacting an eye care professional quickly allows doctors to evaluate the retina and respond early if treatment is needed. Regular eye examinations are also essential. Eye care professionals use specialized imaging tools to observe the retina and detect subtle changes. These visits help doctors track the condition and guide treatment decisions over time. Modern treatments can also influence how macular degeneration progresses. In particular, treatments for wet macular degeneration can help stabilize vision. Medications known as anti-VEGF therapies are commonly used to treat wet AMD. These medications work by reducing the growth of abnormal blood vessels and decreasing the fluid leakage in the retina. For many patients, these treatments help slow progression and protect remaining vision. Early detection and early treatment often produce the best outcomes. This is why regular monitoring and prompt medical care remain essential parts of managing macular degeneration. Macular degeneration progresses at different speeds for different people. Some individuals experience slow changes over many years. Others may experience periods of stability, followed by changes that require treatment. Regular monitoring, early detection, and ongoing eye care all play an important role in protecting vision. Understanding how the condition progresses helps people stay informed, prepared, and proactive about their eye health. With proper care and monitoring, many individuals continue living active and independent lives while managing macular degeneration.
The key idea to remember is this. Macular degeneration often progresses gradually, and regular eye care and monitoring are important for protecting vision. In other Macular School lessons, we'll continue exploring strategies and tools that support independence with vision changes. Thank you for viewing. See you on the next one.